am going to demonstrate the proper way of performing surgical hand washing. Okay. Remember, in the first week, we discussed and demonstrate the proper way of doing medical hand washing. However, for procedures such as surgical wound dressing, it requires another technique of hand washing, and we call it as surgical hand washing. And you would see some similarities and some differences with the two types of hand washing that we have. So the first thing that you're going to do is to check or prepare yourself. Okay? Check your fingernails and make sure it is not long. Check also for presence of jewelries, okay, or any hand accessories. For female nurses, you need to check also if you have artificial polish or artificial nails. You need to remove those things. And finally, you need to check for your skin for any breakage. And of course, you make sure that your materials are ready. We have the sink with running water. We have a couple of paper towels, and we have soap here. So how are you going to start the procedure? Start the faucet, okay, and start rinsing your hand. And when you rinse your hand, start from the fingertip down to your elbow, like this. Okay, rinse your hand up to the elbow area. Okay, rinse also the other hand to the elbow area. And then get soap or sabon. Okay, now, unlike the medical hand washing that before we perform in the first week, at this point you would see that my hands is higher than my elbow. This is the difference between medical hand washing and surgical hand washing. Because we do not want the water from the elbow to go back again to our hand, or else you're going to contaminate your hand. That's why, for the entire procedure, my hands are held higher than my elbow. Okay? Start, creating a ladder. Start with palm to palm, just like what we do earlier. And then after that, what is the next one? Okay, back up the hands. Back up the hands. In between fingers. Thumb. The other thumb. The back of the nails. The back of the nails. And your fingertips. Okay, now, this is another difference between medical and surgical hand washing. In surgical hand washing, we're going to apply soap up to the elbow area. So how do you do that? You start applying hand washing on this side with sabon by doing like this at least 10 times. Now, go lower to the elbow like this. And finally, at least 10 times also. And finally, include the elbow part, like this. At least 10 times also. Do the same procedure with your other hand. 10 times. Below the wrist. Then 10 times. The middle part of your forearm. And finally, to the elbow part. 10 times as well. See, we have applied soap, we have performed hand washing from the tip of our finger down to our elbow. So at this point, I want you to rinse your hand with flowing water. How do I do that? Again, observe this position. Hand should be higher than your elbow. And start with your one hand. Start rinsing from the tip of your fingers down to your elbow in one direction, like this. Okay? Again, take note, hand is higher than the elbow. Okay, one direction. Okay, going down to the elbow, and then done with this hand. Do it again with your other hand. Again, start from the tip of the finger or fingers, going to the elbow in one direction. One direction because you do not want to go back again to the fingers and go to the elbow, or else you're going to contaminate your hand. So rinsing of the hand should start from the tip down to the elbow. So at this point, I'm going to dry my hands with a towel. Okay? Just like medical hand washing, you start drying from the tip of your hand down to your elbow in one direction. See? Okay? And then discard this one. Pick another one. Dry your other hand. Again, starting from the tip of your finger down to your elbow in one direction. And before you dispose this one, you close the faucet and drop. So we're done with surgical hand washing. We can now go to the bedside and start wound dressing. Thank you so much.